I want to start by saying thank you to the City of Brewton, to the Mayor of Brewton. I want to thank Miss Phyllis Neal for helping me get this together. I hope this message that I'm getting ready to present resonates with all of you in Brewton. This has actually been a long time coming for me because this information that I'm getting ready to share, it started with me sharing it with people in Brewton because I was getting, for those who knew I was working kind of in research and with flu viruses and in infectious diseases, started sending me questions, and they started sending me information about what they were hearing about this virus and had questions about it. But then when the vaccine came, I had lots of other questions that were coming about, should we take this vaccine? Is it safe? And so in a traditional setting, I would be able to get on a plane, come down, maybe get people together in the civic center or something like that and talk to people. But this virus has completely changed how we communicate with each other. And from every corner of the world. So for the last 6 months, so after we submitted everything to FDA and the vaccine was authorized for approval, I have spent the last 6 months talking to thousands of people across the country about these vaccines and how safe they are. And so I hope that your questions get answered in this presentation. I already have a few questions that I'm going to discuss at the end, but the presentation is very broad, but I want to make sure that it hits a lot of different points. And feel free to type a question. I guess is that correct? They can type a question,
Yes.
yes, or they can maybe even I guess you can even unmute if you feel please don't feel reluctant to ask a question. There is no such thing as a stupid question. The only stupid question is the one that you don't ask. And that's what I used to hear from my teachers. But this presentation is very special for me because there are a lot of people listening to this call or will hear about this call that mean a lot to me, that I have, even though I may not have seen them in a while. And everything that I know, science, math, English, there are people on this call, or at least still in Brewton, who taught me that thing. I want to give a special thank you to Miss Harriet Godwin, because she has been very much a communicator for me, kind of helping me set stuff up, but just very supportive. Miss Lynette Avant, very supportive. And once again, you see the pattern here. These are all teachers, and these are all teachers who were very influential for me, and many more. So if I didn't say your name, don't charge it to my heart, not to my head, or other way around. All right, so what I'm going to do is I'm going to go ahead and share my screen and go ahead and do the presentation. And towards the end, I hope that everyone who's watching feels free to ask questions. And if you have a question, please don't hesitate to ask. And Ms. Neal, if you can tell me, if you see my shared screen, just confirm that you see it, and then I will go from
Not
there.
yet. Okay.
All right, and okay. All right. So I found these amazing pictures of Brewton online. And so needless to say, there are lots of people across the country now who know, who hear a lot about Brewton now, because every time I present, I make sure they know exactly where I'm from. And so I found these pictures online, but this is going to be just a community conversation. The reason I'm coming to talk to you is because I absolutely care whether you get vaccinated or not, whether you have the right information to decide whether or not you want to get vaccinated, because I know there's a lot of information circulating. I've seen a lot of videos that have been full of misinformation. And so for me, I know that being at the table, being in the process, being in the vaccine development process for the Moderna vaccine, I was actually the first set of eyes to see how effective this vaccine was in a living system, in animal models. And if I had seen anything at that point that was not good, or it was not effective, or it was not safe, it would have never made itself into phase 1 human clinical trials. So I just want to, at least give that preface with that to let you know where in the process I played a role. But then also there are lots of steps between you getting a vaccine and between it being made. So there's preclinical, which is my phase 1, phase 2, phase 3. You have an independent group who gets together and looks at the data from the phase 3, and then you have the actual FDA the FDA portion where they actually go through the data as well, and then they clear it for you to take it. So I just want to make sure that's clear. So really quickly, this is kind of my flow of, from an educational standpoint, from Tuskegee. Then I went to Michigan State for a residency and a PhD program, and then NIH is where I actually finished my PhD work. But that's where I work now, and that's actually how I got involved in this process. They asked me to be a part of the team that would be making the Moderna vaccine. So this is just an image showing in my lab. I'm actually presenting from my lab right now. And so, you know, it's an extreme challenge because not only are we, you know, doing this work, lots of cases, lots of samples of process, but then we have to do it in PPE because we have to do it in social distancing style. And so I have to keep my staff safe. I have to make sure that I stagger them. Some of them, two of them come in early, another one comes in later. And so we have to make sure that happens. But this was all in the middle of the pandemic at its peak, at its highest point. We still had to make sure we were going through. And so, as I mentioned, the preclinical pathology assessment is what we did here. So the reason I'm here talking today is that, you know, as much as you're hearing on the news now, of course, about, and I'm hoping you're hearing positive things because the virus is starting right now. And I want to make sure that's clear. Right now, it's starting to drop. And that is a big part is due to the amount of people who are getting vaccinated. But anytime you have a positive direction, good news, good intentions, good progress, you have gaps in that communication. So you have people who are either just misinformed, you have misconceptions, you have lack of access to either information, or at one point in time earlier in the year was lack of access to supply. So people couldn't find the vaccine or couldn't get it. Now that's not the case. Or people who are just disenfranchised, discouraged. Like, why is it even important? Why should I do it? When I first started this presentation, talking to people all over the place, they were like, well, I don't know anybody who has it, or it's not here yet, or I don't know anybody who's sick. Fast forward a couple of months, now most people know somebody who's had it. Most people know somebody who's died from it. And so it's still a very real thing, even right now, as we sit here now and talk. This virus is still real, and that's why I'm talking to you now, because this is an important time for you to get vaccinated, because there isn't that rush and there isn't the scurrying that everybody has when there's when there's the peak of a pandemic. And now you can still get it, and you can protect yourself and get on about your life, and that's kind of the whole point. But but these are the people who I'm interested in talking to, and so that's what I've been doing for the last 6 months after we got the data to FDA. So along those 6 months, I actually met up with Dr. Oguchika Aloze. He's actually an infectious disease MD out in the El Paso area, and so he was on the front lines doing the clinical work. And so he and I kind of teamed up. We actually, you know, jokingly, we kind of do like a Jordan Scottie Pippen thing. You know, we kind of just play off of each other because it was very natural when we first met. And so we were doing presentations across the country and just really trying to get really good, solid information from a clinical and a science standpoint to people so they can make the right decision. And we've had a lot of success in people, you know, following back up and telling us that they decided to get it, you know, and a lot of it, they just wanted clarified information. So the whole point is to give everyone equal access to facts and accurate information so you can make an informed decision. I know there's a lot of information going on out there. I know everything is moving somewhat, especially when the vaccine first came out, everything was moving fast. But I want to make sure that people have the accurate information they need to make the best decision for them. To this point right now, I think about 60% of the country has gotten at least one dose. Just south of 40% have gotten 2 doses. So then you have the 37% of people who have gotten 2 doses from vaccinations. And then you have another 30% of the country who have immunity right now after infection. So right now we're looking at 60 to 70% of people who have some type of protection from the virus, but we're not quite to herd immunity yet. That's closer to 80, 85%. And so we're almost there, but that's actually why cases are dropping. Post-pandemic, this will be a future where we are intentional, involved in preventative healthcare decisions for ourselves and our families, and active in clinical trials. And I want people to understand that, you know, we can't just be recipients of research innovations. We have to be a part of it, because that's the first question you have. Well, how was it tested? But if you are involved or know more about those, or even your health, your own health, be proactive. Don't wait until you get high blood pressure. Ask the same questions about things you can do beforehand, especially if you know you have a genetic predisposition. or what medications you take. Don't ask questions just about vaccines. Ask questions about the blood pressure medications, because they all are different, and they all were done in the same way that this vaccine was, through FDA, tested in preclinical studies, the human studies, and then went to FDA for approval. So nothing was skipped here. Nothing was gone. And I'm gonna get to a point where I'm gonna talk about how fast this vaccine was made, and hopefully somebody will ask that question. But it wasn't made any faster. It was just the fact that everybody was working on nothing but this vaccine. Everybody who was working on something else, who was in that area, said they paused it and said, we're gonna focus on this. And then the federal government gave $24 billion up front. And that's usually what makes a vaccine process long, is the money you have to raise in between the different phases. That's why it becomes a 2-year process. But when you have everything paid up front, process can move much faster. And then sometimes we can take a position that is not in our own best interest. So only time will tell what the outcome is. And so when I say that, you know, on this call and the calls I've made across the country, the bottom line is that you can be on any side of a political issue or any side of the aisle. That's completely fine. But this virus could care less what your political affiliation is. It'll infect you one way or another: red, blue, green, yellow, purple. It'll infect you, and it will make you think differently about this situation. So don't take a position that's against your own, not in your own best interest, if you have the ability now to protect yourself with the vaccine. So these are the vaccines we have right now. We have Pfizer, Moderna, Johnson & Johnson. Pfizer, Moderna are mRNA vaccines. Johnson & Johnson is the later one. It's the viral vector vaccine. I will have a slide coming up. I explain exactly how they work, so you'll be more informed when you get ready to make your decision. But these numbers, 95, 94, 72, those numbers are, if you're not in the vaccine field or in the vaccine world, they're good numbers. 95 is good, but you just don't know how good. My background is flu was what my PhD was in. I did flu research prior to my position now. And so flu vaccines, to pass FDA, a flu vaccine needed to really only be about 50% effective. So some of our best flu vaccines were 50, 60% effective, and they still protected you. But now you have a vaccine that's 94, 95, 72. We were actually hoping for 50. And now you have this. And so you know that you have protection. But then the question was whether or not in the real world, this would be replicated. You would see that 95% protection, 94. And the honest answer is yes. We know the 2-dose for the Pfizer vaccine is 21 days apart. 2 doses of Moderna, 28 days apart, and a single dose of the Johnson & Johnson vaccine. So I like illustrations, and so I'm going to, I want to make sure that you completely understand how this vaccine works. But I want to make it very simple, because this is how I learn. I'm a very visual learner. So if you look at this illustration on the left, this is a coronavirus particle, one coronavirus particle. The red spikes that are sticking off, those are the spike protein. That's the thing that you've been hearing about over and over again, spike protein. So imagine that the spike protein is a key. The key, and your cells, all the cells in your lung and other places in your body that have the receptor for it, they have a lock. This key can get into those locks. So if this virus gets into your lungs, it lands on your cells. It lands on your cells and it unlocks the door. And once it unlocks the door, it can go in. And when it goes in, if you look at the right, this illustration, this cartoon says, listen up, people. This is a corona takeover. Keep working and follow my instructions. So the cell continues to work. But what it does now, it's just like a GM plant. I did my residency at Michigan State. So I was up there in Lansing, Michigan, and outside Detroit. And so they have those big Ford plants and GM plants. And so those plants make different pieces of cars. That's exactly what the virus does. It takes, if you see those different colors of the squiggly wire on the inside, that's actually the genome. That's the spike protein. That's actually the whole virus genome. But the red part is what makes the spike, the instructions to make the spike. The spike is what is important for us, because if the virus can't attach to your cell, it can't go in, it can't take over, and it can't say, make me again so that I can make a new one. And I have new keys and I go infect your other cells. So the whole point is that I want to make sure that this is emphasized. So could we use some of this to help fight the virus? Some of this information. Remember, the spike protein is a key. If if we can figure out a way to block the key, it can't get in the house. So this slide, I know it looks busy, but I'm going to walk you through it. And I think if I have the ability to pointer, yes. Oh, no, yes. Oh, I don't want to do that. Pointer options, highlighter, laser. There we go. All right. So this over here is our coronavirus. So what we did, so what the team did to design this vaccine, they took the spike protein. Remember, I said the spike protein, these little red projections, they are like keys, a bunch of keys covering this virus particle. This spike protein, you take the information, not the spike protein itself. I want to say up front, there is no virus, there is no coronavirus in any of these vaccines right now. And when I say right now, I mean traditionally, flu vaccines, you have a little bit of flu virus that is either weakened or killed or whatever, so that your body is exposed to the real virus, but it can't hurt you. In this case, we don't have any coronavirus in these vaccines. We just took the information needed to make a copy of the key, because the key is important. Spike protein, number one. So if we start at the top up here, these are vector vaccines. This is the Johnson & Johnson vaccine. This is how it works. The spike protein here, number one. So you take the information needed, the genetic sequence right here, number two. That sequence, we take that sequence, that's the recipe that we need to make another copy of a key or a cake, however you want to look at it. 3D printer, you think about 3D printers, or you think about baking and cooking. We need a recipe to make this right here. This is the recipe. So now the question is, how do we get that into your cells? So in this case, this is the Johnson & Johnson. They have an adenovirus. It's an adenovirus, a human cold virus. This virus cannot make you, it can't make you sick, can't replicate, but they put that information. So it's strictly just a carrier, kind of like a Trojan horse. It just goes inside of it, and it's a vehicle that's taken into, injected into your arm. And so those muscle cells, the muscle cells in your arm where you got injected, are now instructed to make copies of this spike protein. So they go into the cell, get changed. In this case, it's going from the spike protein DNA to RNA to mRNA, and it goes into this structure here. You see the R? That's the ribosome. The ribosome is the oven if you're talking about baking, or it's a 3D printer if you're talking about making a copy. And so after it comes out, that process is called translation. So now you have new copies of the key that your body made. These are not ones from the virus. This is just we gave the sequence. So your body's cell, just like the virus does. The virus, when it infects your cells, it tells your cell, make more of me. In this case, we used some of that information that the virus has been doing for thousands of years, and we took a shortcut and said, well, we're not going to let the virus infect you. We're going to give your body the heads up on the virus. And so now, with these new copies of the key made, your immune cell, this green guy here, picks up that key and says, hey, I don't think this is from here. So it takes that piece of the key and chews it up and takes little pieces of it over to your lymph node. The lymph node, that's why when you got your shot in your arm, if you got a shot, and hopefully you will get one, if you got a shot, perhaps the lymph nodes under your arm swole. They swole because your immune system, your immune cells were taking stuff to the lymph node, and your lymph node was responding to what it was being exposed to. So this key, so the B cells and T cells, the B cells are the ones that make the antibodies. The B cell says, I'm going to make sure that I remember that key if it ever comes around here again, or if anything comes with those keys on it, i.e. those spikes, I'm gonna make sure I get it. So the B cell, what it does is once it's exposed to this protein or to this key, it's going to make antibodies. Now we're talking about after your second shot, 2 weeks after your second shot, that's when you're going to have your highest antibody response. So now B cells are making these little Y-shaped structures. Those are your antibodies. Look what those antibodies do in the case of, now you 2 weeks post second dose, and look what happens if your body is exposed to the real virus. These antibodies are recognizing the keys, and they cover them and coat them. Imagine if you tried to go to your house and you're trying to get in your door, and somebody just kept putting their hand over your door hole every time you try to get in. That's exactly what's happening here. These antibodies coat the virus particle. It can't attach to your cell. If it can't attach, it can't go in and replicate, and that's how you stop a virus infection and replication. So the mRNA vaccines essentially is the same thing, except this one is that we're giving mRNA. And Some people were very worked up about the word nanoparticles. Nanoparticles are nothing more than fat. It's just lipid or fat that's wrapped, that's around, that's carrying that same RNA sequence or the recipe for the key, and that goes into your cell and it goes right there. It's the same process all over again. So I didn't want people to get too worked up about when they hear the word nanoparticles. There's nothing more to it than just lipid, and it protects. And the reason that you have to have something around these sequences because they're very fragile. When they go in and do their job and they replicate, they don't hang around, they degrade. They do not integrate with your DNA. And in particular, the mRNA vaccines don't even go into the nucleus. The vector vaccine is the one that drops off at the nucleus, but still they have designed it where it does not integrate, does not mess with your DNA. But the mRNA vaccines never make it into the nucleus where your DNA is. So they only hang out here in this orange part, which is cytoplasm. So they don't even go anywhere near your nucleus. So they don't need it. So these are just questions that I know that people have had over this last year that I've been talking to people. They've had questions about those things, and I want to make sure that I dispel them. So this list just shows a lot of reasons why people were reluctant to get vaccines among adults in the US back in 2020. And it's funny because I look at all of them, and one of them, number 3, was they didn't trust the government. Now, yeah, some people don't, and that's completely fine. But that's exactly why I decided to start talking to people that I knew, because I'm like, yeah, I mean, there is some reason for people to be not too trusting. But at the same time, as I mentioned before, don't do something that is not don't go against something that is something that is going to be beneficial to you. You know that the virus is out there killing people, right? I think right now the total is 580 something thousand people. That's like the city of Atlanta or the city of Raleigh, North Carolina. If you can imagine, in a year, everybody in the entire city died. That's the scope of how many people have died. And but now we can prevent it. COVID is a preventable disease as it stands right now, because we have vaccines that are beyond just sort of protective. They are very protective. But I wanted to make a point here. One of the top reasons in some cases were people were concerned about side effects and safety of the vaccine. And look over here. Now, if I told you that the coronavirus vaccine had this list of common side effects: cough, diarrhea, constipation, dizziness, erection problems, feeling nervous, tired, weak, headache, nausea, skin rash, weight loss. If I told you that, would you feel comfortable taking that vaccine? Now, that's a rhetorical question because I can't hear anybody. But what if I told you that these are a list of the common side effects of blood pressure medication? These are the accepted side effects of blood pressure medication, and people take them all the time. So that is my point. There's sometimes a disconnect in but it's because blood pressure medications, diabetes medications are common. You know people who take them, aunts and uncles and grandparents. And so that's my point. We have to make sure that we make the right decisions. There's nothing wrong with asking questions, but don't do something that's against your own best interest. This long haulers or long COVID. Before, when this pandemic first started, probably 80% of the people, or I think probably 70, 80% of the people who were dying were over the age of 65. This is before vaccines were available. Now, the question is, when is the last time you heard of an outbreak of COVID in a nursing home? That was the prime spot. That's where everybody was getting sick. But it just goes to show you that these vaccines are working and they're effective. But now, younger people have had the misconception that the virus can't infect them. That's completely false. And the sad part is that people who are younger, because you do have these really strong immune responses, sometimes your body, you can do more damage to your body responding to a natural infection of COVID. And there have been situations now where people have long-standing, long-term side effects of being infected. Multiple systems are affected. About a third of people have neurologic issues between anxiety, depression, sleep problems, nervous system issues, metabolic issues, the GI, skin disorders, coagulation, blood clots. For some people, if you're younger, so cardiovascular. Some people have heart conditions, heart failure, palpitation, cough, low oxygen. Some people are just chronically tired for months after they have been infected. and that's the general malaise or fatigue. So the point is that these things can be avoided just by getting vaccinated. So once again, you might be lucky enough to get infected and maybe not have, maybe not go to the hospital. But you may not, and hopefully you don't die. But then you have these other things as a young person. Now you're carrying situations where you might have been an athlete, but now you have heart issues, palpitations, arrhythmias, and they completely change your life. But it's because you could have prevented them by getting a vaccine. And there's even a couple of studies right now that's showing that people who do have long haulers have shown improvement after they get vaccinated. So there's some hope there that maybe there's some of this stuff can be either reversed or mitigated from just getting a vaccine. So there are lots of things that are still going on, and we're learning about this virus. Leading causes of death have shifted dramatically. The black arrows show where COVID is now in different age groups: 18 to 49, 50 to 84, and 85 plus. 85 plus, COVID used to be. This is back in early 2020. It was the second leading cause of death in people 85 and older. That has dramatically shifted. The vast majority of people now in the hospital for COVID, about 35%, are people who are between the ages of 20 and 40. So it has shifted. The virus is not going to stop infecting people because older people are vaccinated, but that's exactly why they're not getting sick, because they were the ones who went out and got in line, got vaccinated, and younger people were waiting for whatever reason. If you want to wait, you're going to spend the next year or two trying to dodge and hope that you're going to have that anxiety about whether or not you get infected. And now you don't know where you're going to fall. Just because you're young does not mean you can't get severely ill and you can't die. And so I just want to make sure that we see those things. And so the focal point now is getting young people vaccinated. And when I say young people, young adults. So all the numbers we talked about, the most important numbers that I can point to are 97, 100, and 100. And these numbers are standing very strong even in the real world. But 97%, 100, 100, that comes out to be about 98, 99%. You have almost 100% protection from hospitalization and death just by getting vaccinated. Simply by getting vaccinated. I go back to the point that COVID is now a preventable disease. If you decide not to get a vaccine, which is completely a choice, you also, in that same breath, are making the choice to gamble and potentially gamble with getting sick and potentially dying, depending on if you have any pre-existing conditions. Your chances are even greater to have a severe course of infection. So once again, you don't have to get sick, but nobody can make you get a vaccine. And now and I know that masks are the question of the day now, but the reality is that I'm personally going to wear a mask probably until the end of the year, just because I'm vaccinated and everything. But I don't know who around me is not vaccinated. And so you could take your mask off and say I'm fully vaccinated, but the only person in that scenario who's really going to get hurt based on how protective these vaccines are is the person who's pretending to be vaccinated. And unfortunately, that is not the way you want to find out that you're not. That's not the way that you want to, have that happen. You pretend that you're vaccinated, and then you end up being around somebody who isn't. You get sick, and who knows what could happen from there. So the best point is just to go ahead and get vaccinated. These vaccines are very safe, very effective, and they're changing how we are getting back to quote unquote normal life. This one is just showing this, and I just wanted to highlight the one in the middle. Israel, in particular, because it's a small country, a very contained country, they predominantly got the Pfizer vaccine. It just shows that there was a 94% reduction, or very, very high reduction, even in transmission, because that was actually one of the questions too. How effective are these vaccines at preventing people from shedding virus or passing virus on to people who are not vaccinated? And they are extremely effective in doing that. So once again, getting vaccinated protects you in a lot of different ways. It prevents you from being an asymptomatic shedder of virus, or at least decreases the amount of virus that you potentially could spread to somebody. But then it protects you from getting sick, especially in the health systems now. People who are vaccinated, hospital workers, I think like more than 90% of them are completely protected. This is frontline workers. And for the ones who are now getting sick are the ones who maybe delayed or did not get a vaccine, or maybe in between vaccines. So these are all very factual situations that I want people to think about now that you have an opportunity to almost choose what vaccine you want, depending on where you are and what places are around you. So I'm hoping that this doesn't happen. But if you look, we are right now, I think, at about, man, I can't remember the exact number. I think we're probably close to about 10,000 new cases or maybe less a day in the country. But if you look at this chart right here, the black arrow at the bottom shows where India was back in February of this year. They had less than 10,000 cases and they were claiming victory and everything was okay. And then what happened is, because this virus works like this. The more people that are unvaccinated, the more times it has to replicate. If it replicates, it has the opportunity to mutate. If it mutates, it can actually become more dangerous. And so that's what this B1617 virus is. They call it a double mutant. It actually has about 12 mutations, but two mutations that were seen separately in two different viruses, they were now shown to be in the same virus. So India went from less than 10,000 cases then to May, June time. I think today, I think they had over 400. I think they were at 400,000, or I can't, not at 400,000. Yeah, close to 400,000 cases a day and almost 4,000 deaths. Because, and now you look at vaccinations, we're in a situation now where the virus is actually kind of going down, but that's partly because we're getting back out. People are able to get out of the house, and outside there's almost zero chance of, outside in with space in between you, there's almost zero chance of spreading the virus, especially if you social distance. With the wind blowing, the virus would just essentially dilute in the air. But in the fall is going to be the test. The fall and the winter coming up, when people have to go back inside, or whether it's cold or it's rainy and you have to be inside, that's when you typically see these respiratory viruses spike again. So this is the time to get your vaccine and to have protection and not have to worry about another variant popping up and potentially getting sick. So the facts and the truth of the matter is, as of, and this is a slide I had from a previous presentation. So as of May, there were about 680 deaths a day in the US. Almost 100% of those people were unvaccinated. If there is nothing that's more clear that this vaccine is keeping people alive and keeping them out of the hospital. But the people who are dying now are not people who are getting vaccinated. These are people who are dying who didn't get vaccinated or decide they didn't want to. So this is a preventable disease. Out of 95 million fully vaccinated people with Pfizer and Moderna, about 9,000 cases of mostly mild symptomatic infection, and that's 0.009%, or other way of saying it is 99% of people were protected from COVID that were vaccinated. So the 9,000 cases, that's what they call a breakthrough case. Now, those 9,000 are probably not all breakthrough cases, because a breakthrough case is when people are fully vaccinated 2 weeks after their second dose of one of these vaccines. But there are people who get the first shot and they go out and do something and get infected, and they're actually infected when they go back to get their second shot, but then they just don't feel bad until after, and it's too late at that point. The antibodies from the second shot, if you're already infected, you're already infected. They don't help you after you've been infected. So there are lots of things in that number, but in general, it just shows you how effective these vaccines are. So the need for vaccinations is now. You can choose what you want just about. And new variants, there could be more to come. As long as there are people who are unvaccinated, we don't put the right pressure on this virus and it has places to replicate, there's a potential for it to continue to replicate and mutate and then be more dangerous. So the largest spread, as I mentioned, is now, largest spread in hospitalization is now are in young people 18 to 30. So the bottom line is use of common sense and use your better judgment. Long hauler syndrome is a reality, but you can prevent that by getting vaccinated and potentially even try to, and I'm not certain, but there is data pointing to the fact that you might even be able to reverse some of those symptoms after vaccination if you have been infected. So plain and simple, you have a choice. You have now been equipped with accurate information that you can use to make an informed decision. Sole purpose and objective of this was to make sure that this information is fairly distributed over the communities in the state of Alabama. This is a state where I grew up, but in particular in Brewton. I was educated there. As I was telling Ms. Neal, some of the people on this call are probably people who, taught me, who first showed me what a cell looks like. People who taught me how to count, people who taught me my multiplications, people who taught me English. writing this sentence. I before E, except after C. I remember that. And that's probably from elementary school from one of my teachers. And so that, to me, that's why this is so real, because if I can, it's great to work on a vaccine and I could probably rest on those laurels. But what kind of person would I be if I didn't bring the information back to my hometown and talk to people real time and say, hey, look, this is what you need to know. Forget what you're seeing on Facebook about what it can do. It's not going to cause you to not have kids. I will talk about that. But just as a point of reference, in the Pfizer study, phase 3, 23 women got pregnant while they were in that study, because they tell you to not change anything about your routine. 23 women got pregnant in that study. Now, I want to make a point. 23 women got pregnant. One of those women lost their child. That one woman was in the placebo group. She lost that child due to natural processes. But the other women who were in the trial, they're still pregnant or have had their kids at this point. So the point is that there's lots of things. Everything now is about clickbait. You watch the news, especially depending on the news channel you watch, it's all about getting you to watch and getting you to get in. Talk show hosts have made millions of dollars off of this by making you scared to take a vaccine that could let you get on about your life. People making videos. I made YouTube videos, but I made YouTube videos to send down to Brewton and to other places, and because I wanted people to have the right information to know how these vaccines work. So at this point now, I don't want anyone, regardless of race, socioeconomic status, I don't want anybody to experience illness, death, or loss of a loved one for lack of knowledge, particularly when there are 3 vaccines now that give you almost 100% protection between hospitalization and death. So please remain proactive, please remain inquisitive, but remain inquisitive about all your health decisions. I'm probably going to be doing this now. This is actually I've probably made trouble for myself, because I'll be doing this as a part of my job now, doing community outreach, educating people on different disease processes. But I don't mind doing it, because I'm like, at some point in time, you have to have the right information to make the right decision. So thank you for your time. Please stay safe. I look forward to answering your questions, and we will go from there. Thank you. All right.
Can you say the questions?
Let me see if I get back to that. All right. Publish. Okay. All right. So I do see some questions. Yes. All right. So what I'm going to do is I have some questions that are here, and I'm going to kind of just go down and talk. I would actually, you said they do have the ability to unmute and ask a question?
Yes.
Okay. So I would actually encourage, if you have a question, you don't want to type it, feel free. I've done this many times, answer questions. But I'll start with the questions I have here. And so somebody asked about mask recommendations on masks. Now, I admit the information about not wearing a mask right now, I think what happens is after you've been wearing a mask for a year, if you've been wearing it that long, I think people are going to feel somewhat uncomfortable just snatching it off one day. I knew at some point in time that there's going to be a situation where we would have to not wear a mask, or we would be able to not wear a mask, but I'm not ready for it. I feel the mask still provides me a certain level of comfort. And for me, I think it's going to take cases to drop to a certain level before I even consider, especially in big groups. Now I go outside, I'm at home, or I'm out with my kids playing around. Yeah, I don't have a mask on. But if I go to a store, yeah. If I go to I try not to do big groups right now. I'm just not ready for that right now, even though I'm vaccinated. And I'm very confident in the vaccine. But just because you have car insurance doesn't mean you just want to go and ram your car into a house. You still take precaution. You still try to drive safe. I don't want to use it if I don't have to. So that's just my perspective on that. I would suggest you wear a mask, especially if you're going to get vaccinated. If in between vaccinations, wear your mask, because you still have to protect yourself, because you only get partial protection from your first shot. It's your second shot 2 weeks post is when you have full protection. The next question is the progress being made to protect organ transplant patients, and if so, what and when? Now, that question is actually really sticky, because if people are organ transplant recipients, and that means they take immune suppressive drugs. That's actually how a vaccine works. It works by generating antibodies through your immune system. So those people are at risk for severe disease, but they're also less likely to make a strong immune response. So more than likely, those people are probably going to have to take extra precautions and going to have to stay on those medications. So that means they're probably going to have to not get. They might not be able to get vaccinated because they can get the shot. They just may not be able to generate the antibodies they need to protect themselves. So that one actually is still evolving. Are boosters going to be offered anytime soon? Boosters will be available at some point in time, but right now the companies are just making boosters just in case we need them, because right now we don't even know how long the antibody protection lasts from the vaccine, because usually in a traditional setting we're able to go out 2 years, a year and a half, 2 years, and watch the people who were in phase 3 and say, okay, at this point their antibodies start to drop. This is when we probably need to consider having a booster. We're not afforded that luxury in a pandemic. We would have waited 2 years to see when antibodies drop. We would have had another 1 million people plus die in this country. So we have to do these things. We're testing them as we go along. So 6 months, and then they'll test again another 12, and at 12 months post vaccination to still see what titers these people have. Does the vaccine impact fertility? And I just answered that question. It absolutely doesn't. That was a kind of a myth and somebody. So in one part there on the placenta, some people actually refer to a protein they call it a spike protein, but it's like two people named Bob. They're not the same person. They just have the same name. So that somebody put those things together and just assumed that a spike protein vaccine would have some effect on a placenta. But like I said, in the Pfizer study, 20 plus women got pregnant during the phase 3. So there's no effect there on fertility. If the vaccine works, why do we still need masks? That's a good question. We need masks only because there are still a certain amount of people who are not vaccinated. So once again, you could be vaccinated and be very protected. 94% efficacy is great. But if somebody comes by you and they're loaded with virus and they're not sick, not physically sick, but they're shedding virus, they're asymptomatic, but they're shedding, you might get a mild infection. Now you'll be protected, but why even have to deal with that? Just wait until more people get vaccinated, then you can stop wearing a mask safely and securely. Same thing with me. I just feel comfortable with the mask right now. We have to get vaccines every year. We don't know yet. That goes back to seeing how long these antibodies last. If people go out 24 months and they still have very, very high antibodies, and so what happens is you have people who are in the phase 3 clinical trials. That was the 15,000 people who got the placebo, 15,000 who got the vaccine. I'm speaking only about Moderna because I think in Pfizer it was 40,000, 20 and 20. So for Moderna, phase 3 people are going to be watched for the next probably 2 years. And so what happens is when those people start having antibody levels drop, or those people in that group start to have infections, then they're going to say, okay, this vaccine protected them for 18 months or 24 months. So that's when you might see that you get a boost every 2 years versus every year. But we still don't know yet. Right now, 6 months out, 7 months out, it's been still very high antibody titers, but we're still watching to see as this evolves. Does it change a person's DNA? I think I mentioned that. No, it does not. In particular, as I mentioned, the Pfizer and Moderna they don't go to the nucleus, and that's where your DNA or your genetic material is. All that process happens outside the nucleus. So those in particular definitely don't. And then even though the other one has a process that goes through the nucleus, that sequence is designed where it does not interact with your DNA. So that's just understood at this point. Somebody asked about how long this technology has been around. It's actually been around for about 2 decades. And the question is, well, why haven't we used it before? We never had a pandemic in our lifetime either. And so if you imagine having 300 million people in the US, if you imagine having to try to vaccinate 300 million people in a traditional vaccine setting where you have to grow virus up, it has to be very safe, very, very monitored process. The time that it would take to grow enough virus up to inoculate 300 million people, we would have lost many, many more people. This technology is very effective, as we see, but it lends itself to being able to be modified very quickly with small changes. When fully vaccinated, what are the chances of getting the virus? And if so, how will it affect me? That's a good question. When fully vaccinated, you have a much lower chance of getting vaccinated. In the real world setting, I think it's even shown to be about especially Pfizer and Moderna, have been shown to be about 90% protective, if not more. So you have about a 10% chance of, and this is 10% chance of you being around somebody who is just shedding virus, they're in your face, maybe you let your guard down. But even with that, it's still very effective in protecting you. You might get mildly sick, but you won't have to go to the hospital, and chances are you won't die. And that's what vaccines are designed for. They're not designed to completely protect you. They're designed to keep you safe and keep you at the most mildly sick. You get mildly sick with it, but you're able to survive it, generate antibodies, and you don't have to go to the hospital and you don't die. Are some masks better than others? I would say some mask designs are definitely more effective at filtering particles than others. Some people I see just make a bandana. Some people have a t-shirt, they cut the sleeve off. Those things are not made to really capture. A true mask, like a surgical mask, has layers to it, and it's designed to catch particles. In this case, we want to catch spit droplets. Spit droplets, when you're talking, those are what carry the virus and so if you've ever there's a picture on the internet of a person sneezing. It's just a snapshot of somebody sneezing, and if you see what essentially spit or droplets do when you sneeze, then you would know why these vaccines and these masks are so effective. But to follow that same question up, when is the last time we heard about a flu case? When is the last time you heard about anybody getting the flu? Probably not very often right now, especially this last winter, but it's because most people were wearing masks, and flu transmits in the same way. So that's what I want to make sure that people understand, is that these masking is effective, but these vaccines are effective. So if we put both of those together and can hold out a little bit longer, we put ourselves in a position to get back to a more normal life. Would you encourage women that are trying to get pregnant to get vaccinated? Several friends are apprehensive, afraid of the effects of. Yes, absolutely. As a matter of fact, and this is, CDC has actually recommended that pregnant women be vaccinated, because if you're pregnant, your immune system is already suppressed because your body's suppressing its response because it has something inside of it that is trying not to act upon. So you have a suppressed immune response, so that you should definitely get vaccinated. And if you are planning on getting pregnant, as I mentioned, 20 plus women got pregnant. So I would get your vaccine. Don't worry about it. That doesn't have any effect on the reproductive system. Why should a person who had COVID get vaccinated now? Because that's a good question. That's actually a really good question. Because the antibodies that you generate, and this is actually known, this is published, the antibodies that you generate from a natural infection are lower than they are when you get vaccinated. When you get your 2 shots, you have a much stronger antibody response, therefore you're protected. But then don't forget, we talked about the other things about long haulers. If you have any complications that are existing from previous COVID infection, there is data to show that you are actually going to potentially reverse some of those if you get vaccinated. And then the other thing is, if you have previous natural infection and you get vaccinated, you get a very, very strong immune response after you get your 2 doses or of whatever vaccine you take. So having a natural infection will give you some immunity, but much better immunity if you get vaccinated afterwards. Okay. Anybody want to unmute and ask a question? I'm because I actually would like to talk to somebody, because I feel like I've been talking. I haven't heard a person's voice yet. So I'm fine if somebody wants to unmute. And don't be, if that's the case, don't be shy to ask any questions. I'm fine with any questions that you want to ask. And I would be fine with definitely catching up with Marcus when I get back. That's actually one of the reasons I really want to talk to everybody about vaccines too, because I can't wait. I've had so many people that have messaged me back. This is after I had a lady I talked to in Chicago, and same scenario we're doing now. She unmuted, she came on, she said before the talk, she was not going to get vaccinated. After the talk, she said she was going to get vaccinated and she was going to make sure that her family did. She actually messaged me back again 2 months later and told me that she had two sisters that decided not to. Those two sisters didn't fare very well once they got infected. She didn't get infected. She was completely fine. And she was even around those sisters. So this is real world. This is a real world scenario. These vaccines work. They're very safe. And this is the time to get your vaccine now. And I'm not even talking to just people who are a certain age group. Younger and older people alike should get vaccinated, because you don't want to spend the next year wondering, because this vaccine is invisible. This is very similar to having faith. It's belief, and that is unseen. And we already know you can't see the virus, but we know it's very real because of what the impact it has had on the entire world, better yet, your local community. So I just hope this information has made sense to, and maybe answer some questions that people may have. But I hope you make the right decision. Once again, nobody can make you get a vaccine, but I just want to make sure that I would not feel like I have done my job completely if I didn't come back and talk in some capacity to the group. And I've been talking to everybody in Brewton here and there, phone calls, text messages, people who I've been in contact with, but I wanted to be able to speak to people in a mass setting. So I hope this information resonates with you. I hope it answers your questions. I hope it gives you confidence in getting a vaccine. And I'm not just, some random person who just decided to give you information, but I was here for the entire process. And so I've seen it come into fruition, and I know it's safe and effective. I did it myself, and all my family and same thing has been vaccinated because of that. So, all right. So I will pause right there and see if there are any other questions. Oh, let me see. Sorry, I have. Oh, wait. Thank you. Oh, sorry. When will the vaccines be available for kids 12 and under? That's a good question. I think actually later this year. Later this year, I think it will actually be available. I think probably towards the end of the year, and I think probably not until next year they will be available for kids. Probably the younger kids. But those clinical trials are actually going right now. Those clinical trials are going right now. Are there standardized immunity levels for antibodies? No. And so that's where we are. So that's kind of the point. So at 6 months, we know that people have high antibodies, like traditionally high antibodies, high numbers. But the question is, what number is protective? We don't know just yet. And that's where the 6 months and 12 months, and that's where that information is going to come, because at certain levels, you check these people who are in phase 3. I'm just going to make up a number. Let's say their antibody titers are 500. And some people start getting sick. You have breakthrough infections. That's when you say, okay, we know that anything 800 and above seems to still be protective. So then what they can do is determine at that point if a booster is needed or checking titers if that's needed. Do we have to stay with the same vaccination on the booster? I think they're actually looking at that right now, and I think that the honest answer is no. I think once you have received, now don't quote me particularly on that, but I do know there's conversation and seeing whether or not they're actually even looking right now at whether you can essentially cross vaccines and get one of one and one of the other. I don't think that's going to be a point, but especially in those countries where, like now in India, I mean, I think the only two vaccines they had there were AstraZeneca, and there was a Chinese vaccine called Novavax or Sinovac. And I think for right now, U.S. sent their AstraZeneca vaccines over to India because we wanted to try to help in some way. But that's my point. We're sitting here talking about if you want to take one. If a vaccine was available to somebody in India right now, they would be knocking the door down trying to get it, just because they see the true brutality of this virus. And I see there's a question about male fertility. And once again, there's no association, male or female. So once again, there's no association between this vaccine and fertility in either male or female. So there's no concern. So don't worry about that stuff. These are all things that people have used to try to create, media attention or doubt. And there are truly people out there who just want to create chaos and don't want you to get vaccinated. Now, if you buy into it and decide to get your information from Facebook, then sometimes that's what you'll be persuaded by. But please don't, because if you were a person that had a heart issue, you wouldn't go to Facebook and poll the audience to try to find out if you need to get a valve surgery, or you had to get a coronary bypass. You wouldn't go to Facebook for that. So go to a reputable source, talk to somebody who knows about this, talk to somebody who knows about immunology or vaccines, and then make your decision based on that. Not what Facebook or Instagram or somebody has to say. Tell Miss Ash I say hello. Thank you. Once again, these are all just all teachers I remember from kindergarten all the way up to high school. So I want to thank everybody who, and those who helped me. So just as much as I'm trying to give information to you, I appreciate everything that was done for me, because as many people some people may not have been as supportive, but there were far more people that were supportive, and I appreciate that. And I hope to, at some point in time, come back down and be able to see everybody face to face and give a hug, hopefully an unmasked hug at some point in time. So I look forward to it. So I think those were all the questions. Is that right?
Yes.
Okay. All right. So I'm going to give one more request of if anybody has anything they want to say, like if they want to unmute, but if not, then I might let it rest. And this is actually like I said, up until later this summer, I have a couple of questions, a couple of presentations left, but this is actually my finale for the beginning of the summer, and I couldn't end it any better. Definitely, and then talking to people in Brewton. I think that one I've already answered that one about the 12 and under. 12 and under. I think 12 and under will be probably more than likely 12 and under vaccines will probably be available either late this year or early next year, just to be safe.
The City of Brewton thanks you so much for sharing your time with us.
Absolutely. And I thank the City of Brewton for its time, and I would tell anybody who listened to this presentation, I know it's going to be maybe played on other platforms.
It will.
But if you listen to this, spread good information faster than misinformation can be spread. So take this information back, talk to somebody about it, maybe talk to somebody who's hesitant, and hopefully they'll make a good decision as well. But with that, I want to say thank you. I miss everybody. I hope to come down at some point in time, hopefully even this summer. And if I can, hopefully without a mask, but I have a whole bunch of antibodies on board for my vaccine. So I hope you do too. All right. Take care. Thank you, Miss Neal, for helping me set this up.
Thank you. Thank you
Absolutely.
so much.
Absolutely. Everybody take care.
Thank you.
All right.